The Wellness Show, episode 139.
Welcome to The Wellness Show, a podcast on health and wealth. I'm your host, Tyhson Banighen, the founder of the Extraordinary Healing Arts Academy. Join me as we get the latest insight, tips, and strategies from wellness providers, coaches, and successful, heart-centered entrepreneurs, and much, much more. So welcome to the Wellness Show, and today I'm excited to have a doctor on the call, Rachna Patel, and we're going to talk about marijuana. Whoa, this is a really hot topic for lots of people as it becomes legalized in Canada. And it's also, for many, many people, a solution to many, many problems that they've been facing from a health perspective. So it's really good to have this discussion. I think it's an important topic. And what better way to get to the bottom of this topic, or at least to understand it, is to talk to an actual doctor who works in this area. So doctor, how did you get involved in medical marijuana? What brought you to this area of practice?
Sure. So I actually happened on an ad on Craigslist. I was just browsing around one night, and I came across an ad that said medical marijuana doctor needed. And that definitely piqued my curiosity. So I decided to look into it. I looked into the field because I hadn't known that it even existed prior to then. And then what I did was I started to look into the research behind the medical use of marijuana. I started to review all the research that was published in medical journals, and about a year later, I was definitely compelled enough that I decided to gain clinical experience. The way to become a good physician is to not only have the knowledge, but also have the clinical experience to go along with it. So I started to work at a medical marijuana clinic out in California back in 2012.
Wow. So was that easy? I mean, how did you get to work at a medical clinic? Was it like a supervised, or had it already been legalized in California? Or what were the circumstances that allowed you to do that?
Sure. So medical marijuana in the state of California was legalized back in 1996. So, by 2012, the program had already been established for a while. And back in 2004, I believe there was a case that was reviewed by the Supreme Court that actually put in protections for physicians, which basically it said that, physicians wouldn't get reprimanded just for discussing medical marijuana with patients. Prior to them, there weren't such protections in place. So that was sort of the nature of the industry. Now, the other important thing to remember, though, is that I'm going to try to find good words to say this, but the industry was kind of shady, and actually still is. Yeah. Basically, what happened was that you had physicians that just set up shops and were basically just handing out marijuana cards.
This has really been a problem that I see, even with dispensaries now, is that you go in and they hook you up through Skype to some doctor, and who knows, maybe in Thailand, maybe not, I don't know, that does an assessment with a questionnaire, and bingo, you have marijuana. I'm pretty sure that's not what you're talking about.
So no, actually the first clinic that I worked at, that was the case. It was basically a mill where, we were just turning out cards. And, the interesting thing is that the pressure was on to see patients. And I knew that this is within like the first week or two, I was like, this is not how I want to practice medicine. Mm-hmm. But I had to learn the ropes somehow. So I had to earn capital if I wanted to do this on my own. So about 10 months later, I had enough capital to start my own practice, which I did. And what I focused on was specifically walking patients through how to safely use marijuana for their specific medical condition. There are nuances to marijuana that a lot of people aren't aware of. It's not a one-size-fits-all medication.
Well, let's talk a bit about that. I mean, the one use of it that I'm more familiar with, just by what I've read, is pain control.
Mm-hmm.
But tell us about some of the other ways in which it can be used and how you help a patient come to understanding what would be the proper use of marijuana for them.
Sure. So the main conditions that I end up treating in my practice are chronic pain, anxiety, and insomnia. Chronic pain is a fairly broad category, but the more common conditions that I treat within the category of chronic pain are bone-related conditions like arthritis, nerve-related conditions like neuropathy, muscular conditions. So, for instance, patients who have spasticity, such as in multiple sclerosis, and then also just generalized pain as well, like such as in conditions like fibromyalgia. Now, specifically what I'm doing is that, it's just like any other doctor's visit. I sit down with the patient, I go through their medical history, I'm diving into what other alternatives they've sought out for their particular condition. And then what I do is I'm walking them through how to use marijuana. So specifically what I go over is, what combination of cannabinoids to use. And cannabinoids are the chemicals that are made in the marijuana plant. Then we're going over, what's the best method of delivery. You don't just have to smoke marijuana. There are a wide variety of methods of delivery available to patients. Then we're going over, how much to use, how often to use it, when to use it. We're also going over how to avoid side effects, what are the side effects, and what to do in case you get side effects. So that's the general gist of what I'm going over with my patients.
Well, that's a lot. That's a lot. And there's many questions in that.
Yeah.
I think the first big question that comes to my mind is, and I'm curious, have you found in the fact that, alleviating pain or taking away anxiety or stress, have you found that, and then that the marijuana does this very effectively, have you found that then the person can actually start to do self-healing? Have you found that to be a case?
What do you mean by self-healing?
Well, I mean that, if the body energy is consumed by having to deal with pain, and there's no energy in order to revitalize the body or to repair it, then it's inhibited. My sense is that probably if you did marijuana and took away the pain and relaxed the body, that the body could then start to do the repair function. But I don't know that for true. I'm not a doctor. I haven't been able to do clinical studies, but intuitively that makes sense to me. And I was wondering whether you have found that to be a case with some of your patients or not.
Sure. So let's talk about results, and I think that'll help to answer your question. Now, specifically when it comes to chronic pain, some of the results I've seen in my best case scenarios, I've seen that patients are completely able to come off of their prescription medications for pain management, okay? And then the next case scenario is that the patients still do have to continue using their prescription medications, but they're able to take lower doses or a fewer number of prescription medications, right? And then there are cases where they're taking the same number and the same dosages of the prescription medications, but using the medical marijuana is in conjunction with these prescription medications is helping to reduce pain. Now, in a lot of cases, it's just symptom management. It's not actually getting to the root of the cause of the problem, right? But a specific subset of conditions, such as autoimmune conditions, it's getting to the root, sort of getting to the root, in that it's helping to reduce inflammation, which is then helping to reduce the symptomatology of these autoimmune conditions, right? So examples would be ulcerative colitis, Crohn's disease, psoriasis, rheumatoid arthritis.
So tell me again. I mean, I understand with my limited knowledge that inflammation really is, what would we say, the overall symptom that's been translated into many different diagnoses by doctors. one of the overarching problems is inflammation. So how does the medical marijuana help with inflammation? Could you explain that to me?
Sure. So a couple things that are going on, right? So one is that in autoimmune conditions, you have your immune cells attacking the body, right? And what marijuana does is that it programs these cells, these immune cells, for cell death, or what's known as apoptosis. Okay, so that's one way. The second thing that it does is that you have what are called cytokines. Cytokines are signaling molecules in our body, right, that start and stop inflammation. And these are released by the immune cells. So what the marijuana does is that it suppresses the production of these cytokines. And then the third thing that marijuana does is that it impacts what are called T regulatory cells, right? And these are cells that are in place to make sure that the body doesn't basically attack itself. So marijuana activates the T regulatory cells. So it's multiple different mechanisms through which marijuana is helping to reduce any inflammation that's going on.
Wow, that's really interesting. I had no idea that a plant could have so many specific functions that it can deliver to the body. I mean, the exciting thing about this is that it begins to underline, the indigenous knowledge about plant and plant medicine, and how there is a symbiotic relationship between plants and humans, and that I guess we have always known that, even though we spent most of our time in research and synthesizing the actual plant, properties and putting them into pharmaceutical drugs. But the beauty, I guess, of marijuana is that it's not being processed or very little processed. I know you do, if I understand part of it, some of it, you take away the high part of getting high on marijuana in order to do the chemical part of marijuana so it can be delivered to the system. So in some ways it is managed or changed a bit, but it's still relatively mostly the plant itself, right? Like, it's not synthesized.
Yeah. No. Okay. So here's what's important to know. There's a couple different sources that the chemicals can come from, right? So one is that the chemicals can come from the plant itself, and those are called phytocannabinoids. Okay. The second source is that we've created a synthetic version of these chemicals in laboratories, and they're called synthetic cannabinoids, which have then been formulated into prescription medications, right? So I don't know what the names are in Canada, but here in the United States, they're referred to as nabilone, dronabinol, marinol, which is the trade name. And then the third place that we make these chemicals that are similar to the plant is our own body. Our own body produces chemicals that are very similar to those in the plant, and that is why we actually react to the chemicals in marijuana. Right? So the chemicals in the marijuana are mimicking the chemicals in our body.
No, that's really interesting. Yeah. So those are the kind of questions I have, and I know you have a body of information that you'd like to tell our listeners, right? So I'm going to turn it more over to you. There's certain key things that you want people to understand about medical marijuana, how to use it, why it's important, when not to use it. So let's move to that part.
Sure. So let's talk about this notion that the only way to use marijuana is to smoke it. That's actually not the case. Like I mentioned, there are a wide variety of options available, wide variety of delivery methods available. So we can go over those. Just to name a few, there are topicals. So basically this is marijuana that comes in the form of a salve or an ointment that you apply to the affected area. And it works well for a couple different categories of conditions. So it works for skin conditions. I've seen it help with patients who have psoriasis. It helps with bone-related conditions. So it's helped patients with arthritis. And it's helped with muscular conditions as well, right? So if anybody who has a muscular sprain, it's helped with that as well. Then an alternative to inhalation in terms of smoking is known as vaporization. Now, basic premise of vaporization is that it's a method that heats the plant rather than burning the plant. And you avoid what's called a combustion reaction, right? And it's that combustion reaction that's creating sort of the harsh pollutants that are damaging our lungs.
Right.
Other options that are available are edibles. So mainly you're going to find these in the forms of chocolates, gummies, generally candies. Although there are healthier options becoming available. There are sugar-free options, there's gluten-free options, there's vegan options as well. Then you also have what are called tinctures. And basically this is a sublingual formulation of marijuana, meaning that you put the drops, it's a liquid form of marijuana, and you put the drops under your tongue. Then there's also rectal and vaginal formulations of marijuana as well. So a wide variety of options. Now, the other thing, go ahead, you were going to say something.
Oh, I was just curious. I wondered if they've actually done homeopathics with it as well.
What do you mean by that?
Well, homeopathic is where you take a little bit of, and then succuss it, and that little bit then has the power magnified in its potentiality of delivering it to the human system. I know it's in some medical term, in traditional medical sciences, there is some scorn around that, but I know that there's been a lot of evidence that it's worked for lots of people. So I'm just wondering whether homeopathics have been developed using marijuana or not, or whether you're familiar with that.
I'm not familiar, but here's what I can tell you. There's a wide variety of different potencies of marijuana, right?
Yeah.
So marijuana makes a whole bunch of different chemicals. There are two that it makes in high concentrations, and that's THC, which a lot of people have heard of, and CBD. THC is the psychoactive compound. That's what's causing the high. CBD is non-psychoactive. And the plant naturally makes, depending on its genetics, depending on the environment in which it was grown, different amounts of these chemicals, right? And some of the plants have more potent amounts of either THC and CBD, and other plants have less potent amounts of these chemicals. And you can select the various potencies of these chemicals because we now have laboratory testing being done in states, in the United States, where marijuana has been deemed legal for either medical or recreational use.
So are you suggesting that then in your prescription you'd have a potency of 1 or whatever, a potency of 2, potency of 3, you'd have some way of determining the potency of the product that when you go to administer it in whatever way that you think is appropriate for the patient. Is that correct?
So here's legally what happens is that patients are, when they go to a dispensary, they're pretty much free to buy whatever they desire. But yeah, as a physician, I am guiding them on, this combination of chemicals will work best for this condition,
right.
And you're aiming for this particular potency. Yeah, so that's what I'm doing.
Wow, so you've had to learn how to categorize all those, and you say that the tests have already been done in the lab to determine the potencies of these. Now, does it vary from plant, or does it? I'm sure it does, and species to species, right? Genetically.
It's one species, but within the species there are genetic variations.
Right.
And so they make different amounts of the chemicals. And typically, what they do is the raw material is tested. And then once the product is made, then the product is tested as well. Because sometimes in the manufacturing process, the combination of chemicals can sometimes get, sometimes more potent, sometimes less potent. So those are the 2 points generally at which you have testing.
Right. I liked your definition about the different ways of taking it, and then you were mentioning, when you're smoking it, that you have the carbon and you have, some of the toxic chemicals that come from burning the product. And I think that's really important for people to understand that, like you say, there's different ways of doing this, and smoking is only one of them. And it sounds to me like it may not be the best. And
Yeah, so generally I don't recommend to my patients to smoke. Long term, it can do damage to the lungs. We definitely know that people who smoke marijuana on a regular basis are more prone to bronchitis, for example, right? When it comes to COPD, the jury's out. We're not certain, does it cause damage? Does it not cause damage that leads to COPD?
Mm-hmm.
When it comes to cancer, so far the research has shown that it's, the smoke does have carcinogenic agents in it, but what may be happening is that marijuana has some anti-cancer properties, so it may be nullifying the carcinogenic effects. Again, we're not sure. Even when it comes to the anti-cancer properties of marijuana, the information that we have is very preliminary, right? So it's been research that's been done in mice, in test tubes, in petri dishes.
Right. So in the vaporization process, it does heat, right? It does heat it, but it doesn't bring it to the sparkle stage, and therefore it's not as carcinogenic in using it that way. Is that correct?
Yep, that's correct. Yeah.
Great. Wow, so many things to know about this topic that generally aren't being talked about. So as we move forward in British Columbia, are you having an opportunity to put your 2 cents in at any level? Are you being consulted as a practicing doctor in this area around legislation, or how is that working?
Well, we in the state of California currently, it was voted for recreational use, for legalization of recreational use back in November of 2016. Those rules and regulations are currently being drafted, which will go into place in 2018. And what's called the Bureau of Medical Cannabis Regulation is, seeking the advice of just, everyday people on those rules and regulations. But I can tell you that in terms of rules and regulations, it varies from state to state here. Right. A lot of it, though, is being modeled after Colorado, right? Because that was a pioneer state. So in states where marijuana is legal for recreational use, there's still a medical system in place as well, where you can still consult with a physician, to get information. Now, here's the thing, though. Not a lot of physicians are well-versed with marijuana because you're never taught about it in medical school, right? So a lot of what I've learned, and I've been doing this now for half a decade, I've learned through clinical, reviewing the research on marijuana, and then treating patients as well.
So are you available as a consultant to other doctors? Are other doctors consulted with you? And if not, why?
I haven't had too many doctors consult with me about this. Typically what happens is that locally, I practice right now just in the Bay Area. And what I have had happen is that physicians will refer their patients to me. And that's how I'm then consulting with the patients. But what I'm working on, my current project that I'm working on, I know there's a need for this information, in fact, worldwide, because not only has Canada changed their rules and regulations, but so has Australia as well. And this is all recent in the past year or two. So I'm creating protocols by medical condition, so that they're accessible to mainly patients. But if physicians want to take a look at those protocols, they can take a look at them as well. So that's the current project that I'm working on, and it should be completed in the next couple months.
So when is this best-selling a novel or book going to come out?
Oh, you know what? Being a millennial, I have taken to YouTube and Facebook to educate rather than writing a book. Um, I feel like it's more interactive.
Yeah.
And so that's what I've been doing is that I have a YouTube channel, and I also do Facebook Live videos as well. So I don't know if there might be a book, but I think I'm going to pursue the interactive video approach before that.
Well, I love that. I love that. And thank you for bringing a millennial perspective on board, because I think for us older folks, that's a bit of a mystery of how do we talk to millennials and how do they communicate and what's relevant for them to get the information that they need to make decisions.
Yeah.
So I really invite you, and we'll talk about this as we move forward, is the Extraordinary Healing Arts Academy, which I'm the founder of, has a YouTube channel as well. We have online courses, so I would love to make a link into your YouTube channel so people coming to the Academy would have that experience. I also think that because as we move forward with legislation at the Canadian level and Australian level, that your information is extremely valuable and it's important. And I hope whoever's listening to this call in 40 different countries gets the message of how important this is to talk to you so that they don't have to reinvent the wheel, that you've been down this road, have this experience. And rather than trying to create legislation in a vacuum, why not to talk to somebody that's been there on the ground, had the experience, knows what works, but doesn't work, and get on with it. So I encourage doctors to do that, and even legislators, that are drafting legislation to get hold of you. So how do people?
Yeah, I'm humbled by that. So thank you.
Well, I think it's really important. This is important work that you're doing, and I'm excited that you're on the leading edge of this. That you're a vanguard, and not only that, you're a millennial, and you know how you want to deliver your message. And to me, it's exciting that you've got that clarity, right? This is how you're going to do it.
Yeah.
And you're on a mission.
It actually started from just a very logistical need. The way I wanted to run my practice is that the one thing I did not want to sacrifice is the quality with which I served my patients. But at the same time, I didn't want to have, a giant practice. So I utilize technology and try to automate things as much as I can. And so when I brought on a receptionist, what we found was that there were a lot of questions patients had for me, but I couldn't necessarily get to them because I was busy seeing patients during the day. So I sat down and I was like, okay, what is the best way to answer these questions so these patients feel like they're speaking to me, they're getting the information from me? And so that's when I decided to do videos. I started off by talking about different medical conditions, and also, spent a good amount of time demystifying misinformation as well. Like, for example, one of the things that patients always come in thinking is that marijuana reduces blood pressure. Based on research, theoretically, it should reduce blood pressure, but I haven't found that to be the case. So that was, one of the videos that I put out on marijuana and blood pressure. But it really came from a logistical need. But then I saw that, people had tons of questions. So I started answering frequently asked questions as well. But still give that, as much of an interactive experience with me as possible. So it just came out of just a logistical need.
Well, we have 2 more minutes to go, and I know you have some key things that you want to get across. You also need to tell people how they can get hold of you and what your YouTube channel is.
Yeah, so if viewers have questions for me, they're more than welcome to post them on my YouTube channel. You can just Google YouTube, the Medical Marijuana Expert, and my channel will show up in the Google search results. The other place that you can post your comments is on Facebook, and it's the URL for my Facebook page is just facebook.com/doctor with the full word doctor spelled out, and then my first name, Rachna, last name, Patel. So either one of those places, viewers can ask me questions. And then what I do is every 1 to 2 weeks, I post videos providing a fairly thorough answer to the question that was asked, based on research mainly.
Well, I love that. That's very exciting. It's been a real pleasure to talk with you, and I'm excited to stay in touch with you as we move forward. And I can only hope that those that are drafting legislation, both in Australia and in Canada, reach out to you, and that you also have an opportunity to work with a new group of patients that comes through the Wellness Show. So thank you for showing up and enlightening us on this wonderful, important subject.
Of course.
And we'll catch up with you later.
Yeah, thank you for having me on the show. I appreciate it.
And thanks for showing up. Bye for now.
Yeah. Bye. Bye.
For quality online wellness products, courses, and services, visit our sponsors, thewellnessstore.ca and the Extraordinary Healing Arts Academy located at thewellnessacademy.ca. To stay in touch, visit us at thewellnessshow.ca. And until next time, be healthy, wealthy, and wise.